All right, today we are diving deep into a true medical mystery. We're going to put on our detective hats and solve a really high-stakes case. What happens when a pregnancy starts in the wrong place? This is a huge deal, one of the most urgent diagnoses in early pregnancy, and we're going to break down exactly how doctors crack the case. So let's just jump right in with the central question. What happens when the very beginning of a new life goes a little off course? I mean, this isn't just some biological curiosity. We're talking about a potential life-threatening emergency. If it's not caught in time, an ectopic pregnancy can rupture, and that can cause some serious internal bleeding. The whole diagnostic process is basically a race against the clock, all driven by this one critical question.
Okay, so every investigation has to start somewhere, right? It starts with opening the case file. In this situation, a patient comes in with a bunch of symptoms that, create a classic but often really confusing medical puzzle.
These are the initial clues that get the medical detectives on high alert. You've got the classic triad: a missed period, some pain in the lower belly, usually on one side, and a bit of vaginal spotting. Then, during a physical exam, a doctor might find that specific tenderness, or even feel a small mass over by the fallopian tubes. This whole combination, it immediately sets off the alarm bells.
But here's the catch, and it's a big one. These symptoms are super tricky. They can look a whole lot like a threatened miscarriage, an ovarian cyst, maybe even appendicitis. So just having a suspicion, even a strong one, isn't enough. The investigators have to move from just suspecting something's wrong to being absolutely certain. And to do that, they need hard evidence.
So where do they look first for that hard evidence? They go to the blood work. You can think of it like following a paper trail, a hormonal signature that tells a story about where the pregnancy is and, crucially, how it's doing.
And the star witness in this part of the investigation is a hormone called Beta-hCG. Now, we're not just looking for whether it's there or not. A simple home pregnancy test can tell you that. We need the quantitative test, the one that measures the exact amount of hCG in the blood. Trust me, that number is way more than just a number. It is a critical piece of this puzzle.
Okay, check this out, because this is the key. In a normal, healthy pregnancy that's inside the uterus, that hCG level is going to roughly double every 48 hours. But in an ectopic pregnancy, the pattern is all wrong. You'll see it rise way slower, or it'll hit a plateau and just stop, or it might even start to fall. That weird trend is a massive, massive red flag.
Now, this number range right here, this is a critical threshold in the investigation. It's called the discriminatory zone. Think of it like a benchmark that helps doctors make sense of everything else they're seeing. So, what exactly does it discriminate?
Well, here's the rule, plain and simple. By the time the hCG level gets up to 1,500 or 2,000, a transvaginal ultrasound should absolutely be able to see a gestational sac inside the uterus. So, if your hCG is above that zone, but the ultrasound shows the uterus is empty, well, the pregnancy has to be somewhere, right? The guiding principle here is ectopic until proven otherwise.
Now, there is another hormonal clue, though it's a bit of a secondary one: progesterone. Super low levels of progesterone can suggest that a pregnancy isn't viable, whether it's ectopic or just an early miscarriage. It's not really the main player in the diagnosis like hCG is these days, but sometimes it adds another helpful layer of evidence to the case. All right, so the hormonal paper trail is pointing in a certain direction. Now it's time to get eyes on the scene. And for that, investigators turn to their most powerful tool for getting direct visual evidence: the ultrasound.
And let's be super clear about this. The transvaginal ultrasound, or TVS, is the undisputed gold standard for diagnosing an ectopic pregnancy. It gives this incredibly clear, high-resolution view of the pelvic organs, letting the doctor see exactly what's going on in there.
So what are they looking for? Well, first, an empty uterus, especially when that hCG is above the discriminatory zone. And to make things tricky, sometimes there's a misleading little collection of fluid called a pseudo-gestational sac that can try to throw them off. Next, they scan the adnexa. That's the area right next to the uterus with the ovaries and tubes. They might see a mass, something called the tubal ring sign, or, in the clearest cases, an actual gestational sac outside the uterus. Any free fluid in the pelvis is also a big red flag. It could be a sign of internal bleeding. And sometimes, they switch to a different mode, a Doppler ultrasound, which lets them see blood flow. A classic finding here is this ring of fire sign. How cool is that name? It's basically this ring of intense blood flow around the ectopic mass, which really helps distinguish it from other things that might look similar.
Okay, so with the hormone clues and the visual evidence from the ultrasound, the case is really coming together. But sometimes the picture isn't perfectly clear on the first go. So let's look at how they reach that final confirmed diagnosis.
This happens all the time, and it's a really tough spot to be in. The pregnancy test is positive, the symptoms are suspicious, but that first ultrasound, it doesn't show a definitive pregnancy anywhere, not inside the uterus and not outside either. So what do you do now?
Well, this situation actually has a name. It's called a pregnancy of unknown location, or a PUL. Now, this isn't the final answer. It's more like a temporary label. It just means one of three things is happening. 1, it's a very early normal pregnancy that's just too tiny to see yet. 2, it's a failing pregnancy or a miscarriage. Or 3, it's an ectopic pregnancy that's still hiding from view.
To solve a PUL, there's a very strict protocol. Doctors go right back to that key hormonal clue, the serial Beta-hCG test. They measure the level, they wait 48 hours, and they measure it again. The trend, is it rising normally, rising slowly, or falling? That tells them which of those three possibilities is the most likely. And then, a few days later, they repeat the ultrasound to get that final visual confirmation.
Now, in most cases, that combination of HCG trends and a repeat ultrasound solves the mystery. But when the diagnosis is still murky, or if the patient is becoming unstable, there's one final, definitive step. And this slide really compares the non-invasive ultrasound with, well, the ultimate truth teller, a diagnostic laparoscopy.
Laparoscopy is a minimally invasive surgery where a surgeon can put a tiny camera directly into the pelvis and just see with their own eyes. There's no more guesswork. They can directly see the fallopian tubes, confirm the ectopic pregnancy, and this is the amazing part, they can usually treat the condition right then and there in the very same procedure.
Throughout this whole intense process, there are a few other key tests running in the background. A complete blood count, or CBC, checks for signs of anemia, which could mean there's significant internal bleeding. And blood typing is absolutely essential, both to get ready for a potential transfusion and to see if an Rh-negative patient needs a special injection to protect her future pregnancies.
If you take away just one thing from all of this, let it be this principle right here. This is the mantra that guides every single decision. A positive pregnancy test with an empty uterus means ectopic until proven otherwise. It's what ensures this dangerous condition is never missed and that the patient's safety is always, always number one.
It's really incredible when you think about it. The combination of these super sensitive hormone tests and high-resolution ultrasound has totally transformed how we diagnose ectopic pregnancies, and it's saved countless lives. It really makes you wonder, right? With tools this powerful, what's the next great challenge or the next big innovation that's going to help protect health in early pregnancy?